surgical wedge biopsy, and this is a case of lymphangioleiomyomatosis or LAM. So you can see at low power, we start to see these cystic areas. So whenever you see cysts, you really want to know what the lining is, and the lung is no exception. So if we go down and look at higher power, we can see these cysts that are lined by these relatively thin wall, but underneath the wall of the cyst, we start to see this proliferation of cells. And these proliferation of cells have almost a nodular appearance. And the cells range from more epithelioid to spindled as we move around. Some of their nuclei are a bit oval to kind of more cigar shaped. And then if we go to higher power, it's a little bit hard to see, but they do have a bit of kind of vesicular type of chromatin, and but they're relatively bland. And so this proliferation of spindle cells underneath these thin-walled cysts should make you think of a lymphangioleiomyomatosis or LAM. So these cases have a interesting immunophenotype. And so they're typically strongly positive for smooth muscle markers, including smooth actin, desmin, and vimentin. But they have this distinctive feature for immunoreactivity for HMB45 and melon A. So they're often put in this category of PEComa-like lesions or tumors. These tumors typically occur in women of reproductive age, and it's associated with tuberous sclerosis. These patients can present with a pneumothorax, dyspnea, and hemoptysis. And this proliferation of these spindle cells often obstructs the lymphatics. And so this can produce a characteristic chylous effusion, which would appear very white, as a white effusion. You can see more of the proliferation of the spindle cells here. And in this association, they're associated with mutations in TSC1 and 2. And these patients can often have the other features of tuberous sclerosis. And so if you get a history in a patient who has a cyst in their lungs, typically a younger woman, that also has renal masses, you should really think about, could this be a case of LAM?